यकृत हे मातृजवय आहे. यकृत हे रक्ताशयाचे मूळ स्थान आहे. शोणितवाहनं स्रोतसा यकृत मूलम प्लीहाच. यकृत हे पित्त उत्पत्तीचे स्थान आहे व रंजक अग्नीचे स्थान आहे. यकृताचा समावेश चरकांच्या 15 कोष्ठांगांमध्ये व सुश्रुतांच्या 8 कोष्ठांगांमध्ये होतो. स्थानानि आमग्नि पक्वानान् मूत्रस्य हृदय उंडुक उपशिष्ट कोष्ठ इति अभिधीयते. 15 कोष्ठांगानि तद्यथा नाभिश्च हृदयाच प्लवच यकृतच प्लीहाच वृकौच बस्तीच आमाशयश्च पक्वाशयश्च उत्तरबुधं च अधर्बुधं च स्थूलांत्र च क्षुद्रांत्र च वपावहं च इति.
Introduction of liver. Liver, it is the largest and solid gland in our body. It is present most of the covered whole right hypochondrium, most of the epigastrium, and extend towards the left hypochondrium. लिव्हर मेलमध्ये त्याचं वेट हे 1600 ग्राम असतं आणि फिमेलमध्ये 1300 ग्रामीण असतं. लिव्हरचे लिव्हर डिवाइड करतो 2 लोबमध्ये. मोस्ट ऑफ द पार्ट म्हणजे राईट लोब कव्हर करतो, 5th 6th पार्ट ऑफ द लिव्हर अँड 1/6 पार्ट ऑफ द कव्हर बाय द लेफ्ट लोब.
External feature: liver pass surface and one border, the anterior surface, superior surface, posterior surface, inferior surface, and right lateral surface. And inferior border extend from 9 costal cartilage right to left atria costal cartilage. लिगामेंट आपलं इंफिरियर बॉर्डर अँटेरियर सर्फेसला इंफिरियर सर्फेसपासून सेपरेट करते आणि राईट सर्फेसला इंफिरियर सर्फेस सेपरेट करते. पुन्हा इंफिरियर बॉर्डरला दोन नॉच असतील तर इंटरलोब्युलर नॉच आणि सिस्टिक नॉच. ही सिस्टिक नॉच गॉल ब्लॅडरसाठी आणि ही लिगामेंट टेरिससाठी. लिव्हरला 3 लिगामेंट असतात: फॅल्सिफेरम लिगामेंट अँटेरियर आणि सुपेरियर, फिशर कॉर्ड लिगामेंट वेनस पोस्टेरियर आणि फिशर कॉर्ड लिगामेंट टेरिस इन्फिरियर. हे 3 अटॅचमेंट झाल्यावर लिव्हरचे 2 पार्ट पडतात: राईट लोब आणि लेफ्ट लोब.
Right lobe of the liver is larger than the left lobe and it forms 5/6 of the liver, and it shows caudate lobe and quadrate lobe. The caudate lobe is situated on the posterior surface of the right lobe and is bounded on the right by groove for IVC and on the left by fissure for ligamentum venosum, superiorly by superior surface and inferiorly by this porta hepatis. And the quadrate lobe is situated on the inferior surface and is bounded on the right by fossa for gallbladder, on the left by fissure for ligamentum teres and anteriorly by this inferior border. The porta hepatis is located on the inferior surface of the right lobe and in between caudate lobe above and caudate lobe below, and it contains portal vein, hepatic artery and bile duct. And the left lobe is smaller than the right lobe and it forms 1/6 of the total liver.
Peritoneal relations of liver. Most of the liver is covered by peritoneum. Areas which are devoid of peritoneum are triangular bare area on the posterior surface of right lobe of liver, groove for IVC on the posterior surface of right lobe of liver in between caudate lobe and bare area, porta hepatis in between caudate lobe and quadrate lobe, fossa for gallbladder on the inferior surface of the right lobe, just right to the quadrate lobe.
Peritoneal folds, falciform ligaments, anterior and superior surface, ligamentum venosum, posterior surface, ligamentum teres, inferior surface, lesser omentum, coronary ligament, right and left angular ligament, right angular ligament, left angular ligament. Anterior surface, it is triangular, slightly convex. It is related to the zygosternum, anterior abdominal process and diaphragm. Falciform ligament is attached to the surface, slightly right to the median plane.
Superior surface, it has concavity. It is the cardiac impression, and on the each side of the impression it is convex, which fits the dome of the diaphragm, respective dome of the diaphragm. Diaphragm separates the superior surface of the liver from pericardium and heart in the middle, and pleura and lung from each other. Right surface, it is quadrilateral. It is divided related to the diaphragm and postdiaphragmatic recess of pleura, and lower 1/3 related to the diaphragm alone.
This is the posterior surface of liver. This is the from right to left when we see. This is a bare area. This is the groove for IVC, the caudate lobe, the fissure for ligamentum venosum, and esophageal impression. The bare area is related to diaphragm and right suprarenal gland. In caudate lobe is related to crura of diaphragm and colic trunk and inferior phrenic artery. Fissure for ligamentum venosum is a remnant of ductus venosus in fetal life. And this is the esophageal impression.
Inferior surface, it is quadrilateral in shape, and it has, from left to right, it has gastric impression, fissure for ligamentum teres, quadrate lobe, fossa for gallbladder, and CRD, that is colic impression, duodenal impression, and renal impression. Quadrate lobe is related to lesser momentum pylorus and first part of duodenum, and colic impression related to the hepatic flexure of colon, renal impression related to the right kidney, and duodenal impression related to the second part of duodenum.
Blood supply. 80% of hepatic 80% of portal vein and 20% of hepatic artery. Both hepatic artery and portal vein branch into left and right part मध्ये branch येते आणि ते परत liver मध्ये interlebular segmental vessel मध्ये divide होतात. segmental vessel interlebular vessel मध्ये divide होतात. interlebular hepatic sinusoid मध्ये enter होते आणि portal vein आणि hepatic artery hepatic sinusoid मध्ये blood mix होते आणि venous drainage hepatic sinusoid पासून interlebular vein मध्ये interlebular पासून sublebular vein आणि sublebular vein hepatic artery
Lymphatic drainage nodes and deep lymphatic drains into hepatic and cavern nodes. Nerve supply. Liver receives its nerve supply from hepatic plexus, which contains both sympathetic and parasympathetic or vagal fibers.
Hepatic segments. Hepatic segments are on the basis of intrahepatic distribution of a portal vein, hepatic artery, and a bile duct. There are 4 hepatic segments. First is the right anterior segment, right posterior segment, left medial segment, and left lateral segment.
Histology of liver. Liver is covered by Nissen's capsule. There are hexagonal lobules with portal radicals at 3 to 5 corners. Each portal radical contains portal vein, hepatic artery, and bile duct. Portal radical is triangular in shape. Set at the center of the portal radical, and all around the lobule lies the hepatocyte lamina. There is bile canaliculus. Acinus has 3 zones. Zone 1, which has adequate oxygen, toxin and nutrient supply. Zone 2, which has intermediate oxygen supply, and zone 3, which has hypoxia.
Liver is an indispensable gland of our body. Metabolism of liver, metabolism of liver, carbohydrate, protein and fats, synthesis of bile and prothrombin, excretion of drugs, toxin, bile pigment, and cholesterol, and storage of glycogen, fat, iron, and vitamin A.
applied anatomy of the liver. As we have seen in the visceral relations that xiphoid process is related with the liver. So we can palpate the inferior border of the liver by taking one hand's breadth below the xiphoid process. Now the disease is related to the liver. Hepatitis. Hepatitis is the inflammation of the liver. Inflammation of the liver can be due to amoeboid or viral infections. And chronic inflammation of the liver leads to liver cirrhosis. In liver cirrhosis, there is fibrosis or shrinkage of the liver tissues. And liver cirrhosis causes obstruction of the blood coming from the portal vein. And this is called as portal hypertension. And due to portal hypertension, there can be ascites or caput medusae, which are visible veins near the umbilicus, prominent veins.
A liver biopsy, it is done when the needle is inserted to the 9th intercostal space. As the liver is the main site for the metastasis tumor, then the PET is the positron emission tomography, which is in which the radiography molecules are passed through the body to identify the abnormal cell wall. Then there is the liver resection. In liver resection, it is done in the primary and the secondary tumor, in which the 80% of the part of the liver is safely removed, and it can regrow up to 6 to 12 months to its original size. Then there is a liver transplantation, in which the liver at the end stage liver disease, it is transplanted, and the